people heard the word lung cancer, it was even more terrifying because people thought, people don't survive that, but we do.
In the fall of 2014, Nancy Smith's life changed forever. She first noticed a cough that wouldn't go away, pain in her shoulder, and shortness of breath.
A lot of times I think, especially working moms, busy, I thought, well, I've just got a cold or it's the flu. So I went in and had a chest x-ray, and it didn't look good. Looked like I had pneumonia. And one of the things about diagnosing lung cancer is you actually need a CT scan to properly diagnose. So I was treated for pneumonia for a few weeks, and then I went back for a follow-up, and nothing had changed.
And that's when Smith went in for a CT scan with contrast, where her doctors found a tumor on her left lung the size of a lemon in February of 2015.
One of the things that was a little bit disheartening at the time was, even though I knew what my biomarker was, there was no treatment for it. And so I had a couple of lung surgeries, and they actually removed my entire left lung, and I did some general chemo. So thank goodness the surgery at that time was what saved my life.
Now, she's currently the Lung Force hero for Mississippi. Smith recently went to Washington, D.C. for the third time to meet with members of Congress during the American Lung Association's Lung Force Advocacy Day.
Part of our goal in going to Washington is to say thank you to our legislators who have done an amazing job of finally putting some funding towards not just lung cancer, but other cancers. And so what we have found out with these new immunotherapies and targeted therapies, that they not only work in helping lung cancer, but they also work in colon cancer and melanomas. And so that has moved the needle on improving survival rates for a lot of different cancers.
She joined more than 40 other people across the country who have been impacted by lung cancer to ask lawmakers to support $51 billion in research funding for the National Institutes of Health and $11.6 billion in funding for the Centers for Disease Control and Prevention, and to support and protect Medicaid.
It's just empowering to see a person from every single state on Capitol Hill wearing turquoise, our color, and giving them our stories of hope, but also that everyone needs to be able to have access to care. I think 25% of Mississippi's lung cancer patients are dependent on Medicaid for their treatment. So it's very important that everyone have access to care and that important testing, and also low-dose CT screenings.
Smith says since her diagnosis, there are almost 20 new drug treatments for lung cancer.
And Smith says when going through a cancer battle, it's nice to have other people who are walking in the same shoes as you for support. That's why she hopes to mentor those diagnosed with lung cancer and be there as a resource.